According to recent statistics, there are an alarming number of Americans trapped in the brutal cycle of addiction. Experts say addressing one's struggle with substance abuse means understanding the emotional, developmental, physical, psychological, familial, social, and cultural factors involved in their addiction, which is why the right integrated treatment modality, one that provides responsive, personalized care, can be very effective.
The single most prominent reason we are seeing a spike in this country in addiction is the opioid epidemic. Pharmaceutical companies convinced medical personnel that opioid medication was safe and effective for the treatment of chronic pain. And of course, this led to overprescribing and this led to patient misuse. And for those patients who misused opioid medication and became addicted, they then became 40 times more likely to use heroin. The connection between mental health disorders and substance use, in my experience, is very strong, and they're intertwined. For this reason, integrated treatment gives the patient the best opportunity for success in recovery.
Established in 1964, Willamette Family provides readily accessible, quality mental health and addiction care for men, women, youth, and families in an atmosphere that promotes compassion, healing, respect, and well-being for all. A leader in the field of alcoholism and drug addiction treatment for over 50 years, Willamette Family serves clients in 7 residential and outpatient sites across Lane County, Oregon.
While all addicts are human beings, not all human beings are addicts. To seek our help takes a huge act of courage because of the stigma that has followed them for many years. Our mission is to make sure that that person receives any care that they might require so that they can access treatment and begin that road to recovery.
Willamette Family provides a full continuum of care services to individuals and families, including substance abuse treatment, mental health treatment, detoxification, and on-site therapeutic childcare. Here, many people work together to provide the best possible treatment services to help meet the needs of patients with both mental and substance health disorders and help them and their loved ones along the road to recovery.
The first step really is for the patient to sit down with the clinical staff and work towards identifying what some of their goals would be and how they may achieve them throughout the course of treatment. When a person comes to the end of their treatment stay, they will have most likely participated in a number of activities, including group therapy, co-occurring therapy, cognitive behavioral therapy, and we offer a wide variety of parenting and family group support.
As the needs of its community increase, Willamette Family proactively responds. Believing addiction is a family disease and a child's needs must be incorporated into a successful treatment and recovery plan for their parents, Willamette Family's family services model integrates the multiple needs of families touched by the disease of addiction.
The most important benefit of having co-residency and providing wraparound family services and parent education is that the parent learns the skills so that they can be the parent they want to be for that child. We are really proud that in our family service program, 80% of the children remain safely with their parents and never have to go back to foster care.
I grew up in a drug environment where drugs were the norm. I tried everything. By the time I was 13 years old, in and out of treatments, in and out of prison. The pivotal moment in my life where I changed my behavior was when I was 31 and they took my children from me. I found Willamette Family because my DHS caseworker at the time recommended me go get an assessment and go to their inpatient facility. When I came to Willamette Family, the main thing that sticks out to me is the cognitive behavioral therapy that I learned that was individualized for the behaviors that I was doing and showing and exhibiting, and it was specifically for me, and it really stuck to this day. Willamette Family truly changed my life in every aspect of my life.
Treatment is an investment that breaks cycles of addiction, saves lives, and keeps families together.
I've been using meth off and on since I was about 16. I had a lot going on in my life. Lost my kids, other stuff. I was living in a car pregnant with my fiance. I went into labor at the hospital. I asked them for help basically, and they sent me to Willamette Family, and I went into Cheshire 4 days after I had my baby. We've been doing great, 21 months clean and sober. My fiance's got a great job. We love life now.
Addiction is a brain disease. It's a chronic condition and it can be fatal. The great news is that treatment works. And it's important to take that first step, to be courageous and know that there is help there and that you can make a difference in your life and in the lives of those you love.
Learn more today about Willamette Family, health, wellness, and recovery. For more information or to schedule a free consultation, visit WFTS.org or call 541-762-4300.